Well, for the first few years that I practiced, I was very much a general neurosurgeon. I still enjoy cranial work and do some tumors and things, but I would say my focus is more and more on the spine, and particularly the minimally invasive surgery. I would say herniated discs in the neck and in the back, and unpinching spinal stenosis. Those are probably the most common procedures that I do. I try to visualize myself in that seat where the patient is sitting. And so when I recommend a treatment, either surgical treatment or perhaps recommending that surgery for them is not an option, then I try to give them the same treatment that I would want or that I would want my family to have.
I was impressed from the very moment that I met him. His staff, his nurse Wendy, and when my wife was with me and we sat down, and I guess it's like anyone that you've met for the first time, you're basically putting your trust in this person, especially as a physician. But I never had any doubt. You know, honestly, I don't know how many patients he sees, but even though he's as busy as he is, he doesn't make you feel like you're being rushed. You know, he listens to what you say and pays close attention to what you say.
I think that's probably key, is just to try to be a person first, and to be a person that cares about them and that wants to do my best, from my perspective, to help them with that problem. I worked with a local engineer here in San Antonio and developed instruments that were curved or bayoneted so that they could be used with an operating microscope rather than an endoscope. And then it was in the either late 90s, early 2000s that I met with Dr. Foley and some others, and we developed the Medtrex system with Medtronic, which was the first tubular dilating system specifically designed to be used with a three-dimensional microscope. We have these cushions between the bones and our back and neck that are discs, and they cushion the spine, allow us movement as well. These discs can fragment. So I think the first application with these tubular systems was simply to remove these herniated discs, these discs that had broken loose, and relieve the pressure to hopefully cure arm and leg pain, weakness, and other problems caused by this pressure. And then as we've gained more experience over the years, we've extended the application to deal with what we call spinal stenosis, which means narrowing of the spine. It may not be a disc herniation, it may just be overgrowth of the bone. So we can also use these systems to decompress or unpinch the nerves. I try to fuse only if there's an absolute indication for fusion, and there are reasons to fuse, but fusions tend to, sometimes they're of course necessary, but at other times fusions can create problems at the levels next to the fused level. So I try to use fusion sparingly in my practice. I think it was Robert Louis Stevenson that said something to the effect that physicians, they do receive, I think, personal satisfaction for those that they help, but they really only, they remember those they couldn't help almost more and wish they could help everyone. And I think that says it for me. It's gratifying to be out about town and to see someone that maybe I've worked on recently or in years past and come up and express gratitude to me for being able to help them. And certainly we do the best we can for everyone.